Why some hospitals lack the oxygen to keep patients alive. The shortage affects patients with every kind of respiratory ailment requiring oxygen, not just those with COVID. The latest horror of the pandemic is that large number of people around the world are dying for lack of access to medical oxygen, especially in India. Each day, tens of thousands of people are admitted to hospitals with COVID 19, driving the demand for the oxygen far beyond the supply. Oxygen makes up 21% of the atmosphere. A handful of companies capture and purify it in bulk, but they sell most of it to industry. Many poorer parts of the world lack the infrastructure needed to deliver or make use of the medical grade supplies those companies sell, which are designed to be delivered via pipes to hospital rooms. Some hospitals and clinics have machines that produce purified oxygen at a much smaller scale, but they are in short supply. So, many hospitals and patients in poor countries and in remote areas rely on the most expensive oxygen tanks that have become scarce in the countries hit hardest by the virus. The shortage affect the patients with every kind of respiratory ailment requiring oxygen, not just those with COVID. The World Health Organization said in February that 1.6 billion would be needed to remedy the oxygen shortage for a year. Now that estimate is up to 6.5 billion. Efforts to raise that money have faltered, although it is a small fraction of what has been spent on vaccines and financial support for business and workers. So here are the answers to some of the questions being asked about the oxygen crisis. How did it get so badly, so quickly? Given the enormous and obvious need for oxygen during a pandemic affecting the respiratory system, the crisis should not have come as a surprise. But in a year when policymakers lurched from one pandemic challenge to another, PPE shortages, lockdowns, the threat of economic collapse, remote schooling, therapeutics, vaccines, oxygen supply never rose to the top of the list. Oxygen hasn't been sufficiently prioritized, said Robert Martineau, program director at United, one of the global public health groups working to address the shortage with the WHO. Even before the pandemic, some poor regions were unable to ensure adequate supplies. But it was not until this year, when lethal oxygen shortages hit Brazil, Mexico, and elsewhere, that it became clear that it has seen a potential problem was becoming a dire emergency. The WHO created an emergency task force on the oxygen shortage and called for money to address it. Then the pandemic surged in India, where it had been relatively contained, pushing oxygen supplies to the center of the world's attention. India's official count of new coronavirus infections leapt from an average of about 11,000 a day in mid February to daily average of more than 370,000 in the past one week. An expert said the true figure is far higher. In the past 2 months, the unmet global need for medical oxygen has more than tripled, from less than 9 million cubic meters a day to more than 28 million, according to a coalition of 8 groups that are tracking the crisis. About half of the unmet needs in India, and health advocates warn that the calamity there could be repeated in other countries. How is oxygen made and supplied? In wealthy countries, hospitals generally rely on tanker trucks to make bulk deliveries of liquid oxygen, far denser than regular air, that is stored in large containers. A system of pipes draws out the gas, allows it to expand to ordinary density, and delivers it to each bedside. This is by far the most cost effective way of supplying oxygen, and companies that supply bulk oxygen have enough production capacity to meet global medical demand for it. In just the past few weeks, some of them have begun ramping up their production of medical gas by diverting some from industry, whose gas has somewhat different requirements. India government has ordered the producers there to temporarily direct all of the oxygen output to medical needs. But many hospitals around the world are not equipped to make use of liquid oxygen, lacking the pipes to distribute it to patients. And there is no delivery system in place for many remote locations. Oxygen can also be obtained in less dense gaseous form, in cylinders that need to be refilled more often. This is often the most expensive option. It can cost 10 times as much as bulk liquid oxygen, but it's the only available to many parts of the developing world. In many countries, people have scrambled to buy or refill such cylinders for the family members, but demand has far outstripped supply. Some hospitals have their own plants to extract oxygen from the air, a technology known as pressure swing absorption or PSA. But the systems are expensive, and a hospital that buys one would also have to install a system of pipes to deliver the oxygen to bedsides. There are also small devices called oxygen concentrators that can serve a single patient or a few. Although one can cost several $100s, a high hurdle in poor countries, demand for them has soared faster than manufacturer can produce them. What is needed to solve the crisis? Money and time. Public health advocate says hospitals should have PSA plants and the piping to go with them. But in poor countries, the solution can be cost prohibitive, achievable only with international aid. India's government plans to install the equipment in hundreds of hospitals, but that could take months. Companies that make PSA plants and oxygen concentrators are ramping up production around the world, but that too takes time. Bulk oxygen producers and government are still trying to adjust supply chains to get the life-saving gas where it is needed most. In India, the government is using trains and even military transport planes to get oxygen to the sick. If enough money were available, government and international group could have advance purchase agreement with bulk suppliers, and emergency stores of oxygen should be stationed in various parts of the world and deployed as needed. If nothing else, the past few months have made clear the difficulty of trying to increase oxygen supplies on short notice amid a crisis. Instead, Maitru said the world should invest in preparation so that if there is a surge, we can press go. Thank you.